Yo, what is going on? Stop. What's up, everyone? My name is Akmal, and I'm a dentist. Let's watch the removal of that humongous dental tartar as well as dental cleaning visit. That is one of the biggest, most gigantic dental tartar pieces I've seen. Look at it. Looks like there's something attached to it, like some tooth structure or something. Look at that, along with the dental tartar. Looks like crazy. Okay, so the operator here is using an ultrasonic scaler with uh, water cooling. And if you notice something, they're trying to slowly deconstruct or break that huge dental tartar piece into smaller pieces to make it a bit more easier to do the dental cleaning. Um, it looks like they decided. I mean, there's a lot of dental tartar on other teeth. I don't know if you can see really well on the molar, on the rest of the teeth, but they're trying to slice through that huge dental tartar piece. Looks really interesting. That's why I picked this video for you. By the way, I linked in a playlist of similar videos if you enjoy me reacting to such things, which is, I don't know if it's a good idea, it's up to you. And they're slowly slicing through that huge piece of dental tartar, and it's slowly moving. This is pretty insane, to be honest with you. Like as I said, they keep trying to break that dental tartar piece apart. Looks like, oh, one piece popped off. Underneath the tongue of the patient, there's the suction to. Why they couldn't. I understand why, because suction has only so much force. So they used a tweezer, if you saw, in order to remove that piece, and they're still breaking that huge piece of dental tartar apart. This is pretty insane stuff, to be honest with you. I mean, it's relatively rare, even for a dentist, to see something like this. I mean, if someone sees these things commonly, then I don't know what to say to you, except like good luck. As I said, there appears to be some form of tooth structure attached to this total mess. At least that's what I can see. It's a bit difficult to identify as it's covered up with all of that dental calculus and dental tartar. Of course, they do zoom in. Look, they just brought in an elevator. This is called an elevator, what it appears to be. Um, they're using some, actually, the elevators and luxators, they're typically used for tooth extraction purposes. They're trying to push away with an extraction instrument, let's just say, to remove. Look at all of that. What a mess, a total mess. Of course, the gums underneath that are inflamed, they're bleeding as well because all of that cumulative inflammation. This doesn't happen, folks, overnight. This takes a time to occur. Time of poor oral hygiene over a sustained period of time for all of that dental calculus to occur. Yes, there are certain medical diseases that can make this worse, but in general, it's really associated with poor oral hygiene, especially when it reaches this exaggerated state. And right now, they're proceeding with, scaling, and it looks like there's an extraction socket side, if I'm not mistaken, as to where that humongous dental calculus was attached, or this is what it appears to be, and maybe it was stuck just there because that side is quite bleeding a lot. The assistant is helping with suctioning all of that bleeding and excess water. The operator here proceeds with the dental scaling procedure, and look at Like there's so much dental calculus it's even filling up the what we call as the occlusal surface of that molar, as in that surface that we bite or chew on. So I'm doing insane stuff, and as you can see, the operator here is trying to go over the calculus that's stuck in these grooves and trying to remove gradually, and also trying to remove any remaining stains that can be removed. And if you look at the ultrasonic device or the ultrasonic scaler, pretty much the really integral or important component is its tip, that relatively sharp and effective. A tip, it's the one that's doing most of the work with the water cooling system. They're proceeding into the molars behind, and it looks like this is first, second, and there's a third molar. If you look closely inside, of course, they're scaling now the lower. This is sort of a dentist view, and that third molar seems to be not fully erupted. There's some gums covering part of it. As we proceed to the back, it becomes more evident what I'm talking about. It is that looks like a wisdom tooth. That's because first, second, third molar, i.e., the wisdom tooth, and there's some gum tissue covering it. To be clear, problem with that gum tissue is that if it fills in with some dental plaque, fud, and debris, it can get inflamed, and this can be a very painful condition, and that's called pericoronitis. But this video is within the context of dental tartar, dental plaque, and dental scaling and cleaning. The operator here proceeds with this, and they're really trying to clean all of that dental calculus that's stuck in the grooves of the molars. It looks really interesting. And of course, that area of which that huge dental tartar was stuck is bleeding a lot because the gums were really inflamed in that region. And this is a very important view of the uh, uh, front teeth because they're starting to remove the dental tartar and dental calculus there. The operator here is gradually going tooth by tooth, and they're as you can see, not only focusing on the dental calculus and dental tartar stuck at the gum region, but also some of that dental tartar and stains and dental plaque is proceeding to other thirds of the tooth crown. If you didn't know, the tooth crown is divided into three thirds in general. Yes, it is true that dental plaque and tartar commonly accumulates at near the gum region, but also it can form in other places of the tooth. So interesting so far. As you can see, there's copious amounts of water cooling as that ultrasonic scaler is doing its job. So some of you may wonder, why do we really have water cooling? Well, as the term calls, water cooling to avoid overheating of the tooth, and also it helps cleansing that area that the operator is working on. As you can see, the ultrasonic scaler is also good at removing the stains that are stuck on the teeth. So that's why dental cleaning can help improve the aesthetic or the appearance of the teeth. But when a person, oh, look at that upper, just huge portions of dental calculus that's accumulated on the teeth. That is so much dental tartar, and some of it even gets heavily stained. Wow. That is so interesting. That is so interesting. Okay, so we have an opening or duct opening for a salivary gland near the upper molars buccal region. And in the saliva, while it's yes, its components are helpful for remineralization and such, but those minerals can also participate in the formation of that dental calculus, and hence why it's common to have dental calculus on the surface of the molars as well as on the inside of the lower teeth or the inside of the lower incisors. To be more technical, this is called the buccal surface of upper molars, and the inside called the lingual surface of lower incisors, because some people are a bit too detailed, and I like that, by the way. The operator here is proceeding to remove all of that calculus. So far is doing pretty well. Even we need to remove even like the small pieces that you see here and there, because these small pieces is just going to make it easier for more dental calculus and dental plaque to build over it. I can also see, yes, that's what I was about to say. There's a lot of dental tartar forming on the chewing surface of these teeth as well. The operator here is doing a great job so far. This is they're proceeding with other surfaces. The teeth, I can see palatal structure. So this looks like the inside of the, not the inside, but rather the palatal view, palatal because it's toward the palate, view of the molars. Now you know some new terms, so you can act smart when you visit your dentist. I'm joking, by the way. You don't need to do that. Mm, mm. So much dental confidence. As I said, the really sad part is some of it is on the literal chewing surfaces of these teeth. I mean, it's going to even impede or cause problems for chewing for a person like this. And it's really sad to see, to be honest with you. We have the suction here from the assistant to help suck all of that excess water and fluids and saliva as well. The operator here would like this. They're trying to be as detailed as they can with the removal of that dental calculus and dental tartar. Okay, they're going on from the molars, proceeding further to the premolars. So as you can see, these surfaces dental calculus forms on them because some people may forget or they may ignore these regions and they may not clean them at home. So it's very important to brush these regions. I'll try to link some electric toothbrushes or water flossers that can help you. Oh, look at that huge thing. And oh, it disappeared. Great job, great job. That's all for today. Don't forget everyone to subscribe, like, share this video with your friends. Check out the playlist.